The head of the United States Center for Disease Control and Prevention warned Tuesday that a second wave of the coronavirus pandemic expected this winter could be deadlier than the current pandemic. As of April 22, 2020, updated figures report that nearly 178,000 people have died due to coronavirus pandemic worldwide. However, experts are claiming that the world has not yet reached the peak in terms of disease spread and that there may likely be a second wave of viral infection that will continue the turmoil. Robert Redfield, director of the CDC federal agency, warned that a wave of coronavirus next winter would coincide with the normal influenza season. He said, "We are going to have the flu epidemic and the coronavirus epidemic at the same time. Having two simultaneous respiratory outbreaks would put unimaginable strain on the healthcare system." Redfield said federal and state officials need to use the coming months to prepare for a worst-case scenario. As the stay-at-home orders are lifted, officials need to stress the importance of social distancing and hand washing. Though disease spread in general is extremely complicated and many unknowns still exist regarding the containment of and solution for COVID-19, two potential reasons have been offered for the possibility of a second wave. Number 1. Mounting pressure to ease restrictions. One of the most important aspects in controlling the spread of the virus thus far has been the interventions taken by many governments and leaders worldwide in urging their citizens to follow strict isolation and social distancing measures. However, due to a variety of reasons, this is becoming increasingly difficult. One of the most prominent reasons that has been recently cited is the growing economic turmoil of isolation, given that the rapid spread of the virus and countrywide shutdowns have forced millions of layoffs as well as the closing of small businesses, retailers, and other non-essential industries. Economists are calling this situation a divisive political tug-of-war between choosing to restart the economy versus continuing social distancing in order to prevent spreading the virus even further. This simultaneously explains that one possible solution may be to test everybody and open the economy up to those that aren't infectious. However, this may simply not be possible at this time, as some experts are indicating that at least 500,000 people would need to be tested daily in order to restart the economy, a figure which may be difficult to achieve given the current lack of resources. Nonetheless, government leaders are facing mounting pressure, especially in the United States, where unrest and protests against the lockdown are continuing to grow. Number 2, difficulties in finding a sustainable solution. The nature of viruses is that they transform and adapt, which has led experts to believe that the coronavirus may become a seasonal virus like influenza, thus making future waves of disease very possible. For context, the flu virus requires a yearly vaccine as it changes over time, and an updated yearly vaccine provides coverage against what is projected to be the most common strain of virus for that upcoming season. While this is one theory that is being pursued, the stark reality is that even developing a preliminary vaccine for COVID-19 will take time given the significant amount of efficacy and safety testing it must go through, let alone the efforts required to create massive amounts of it in a short period. The world will likely need hundreds of millions of doses to even begin to quell the current pandemic. These critical factors, therefore, present a deadly possible reality. Easing governmental restrictions and protection measures without a widely available testing and therapeutic solution may be the ultimate recipe for a second or even multiple future deadly waves. Thus, local and national governments must continue to urge and enforce strict containment methods, as lack of doing so will only be more detrimental in the long run. This in conjunction with an increased emphasis on testing and a widespread effort to develop a vaccine, is the only way that the world may be able to soften the blow of what is yet to come from this deadly pandemic.